Hi, my name is Dr. Eric Janowitz. I'm the clinic director and founder here of Synergy Oviedo Chiropractic. I have had the privilege and honor of serving almost 20,000 patients in my 20-year career here in Central Florida. And unfortunately, several thousands of them have been involved in car accidents. Now, when we're assessing how they're progressing and what are the risks for them to develop a chronic problem, or unfortunately, it could be a permanent problem, we want to look at risk factors involved in chronic whiplash and what does the research show, not just, hey, what does my car show? Maybe my car had little damage and I think, well, I must be okay, or maybe it had severe damage. We want to look at risk factors because the research shows that that is equally, if not more important in understanding the outcomes, which at the end of the day is you want to get well. What are the things that are against you in potentially getting you well? Well, here are the top risk factors for chronic whiplash, chronic problems. The first one, unfortunately, and don't shoot the messenger, is female gender. Now, why does that occur? It's just a simple anatomy that the neck could be thinner in the female sex compared to their body, and then therefore there's less muscle mass to slow down the acceleration and deceleration forces of an auto accident, which can be more prone to a neck type injury. The next one is rear impact. So if you were involved in a rear impact collision, meaning your car was hit from behind, then that is a risk factor. Even worse, if you're hit from behind and then you hit the car in front of you, then you actually had like two traumas to your spine as well. The other one that you want to look at is immediate early onset of symptoms and severity of symptoms. You know, we often see patients come in the day of the accident or several days later, and we ask them, when did the symptoms first start? Now, at the beginning, you may not notice symptoms in the first couple of hours because you have adrenaline pumping through your body, and that hormone is protecting you to help you handle the current situation. But later that night or the next morning, you feel like a train hit you. Well, if you have those immediate early onset of symptoms and the number of symptoms, those are risk factors. So if you had some soreness and some symptoms within the first day of the crash, that is a risk factor you want to be aware of. Another one is ligament instability. So you want to find a chiropractor that is doing specialized x-rays, that is taking you to do what's called a flexion and an extension x-ray to see how your body is doing, not just a plain film saying there's no fracture, you must be okay, or looking at things like MRI. And a proper chiropractor can also get specialized testing with MRIs where they can also do weight bearing, and they can also have certain radiologists understand to look for inflammation as well. So it's a very detailed approach. Another one is greater subjective cognitive impairment. What that means is if you're having problems with memory or having problems with focusing at work now, or those sort of challenges, that can be an indicator of chronic problems. Greater number of initial symptoms. If we're doing your history and you're feeling pressure in your neck, your upper back, your low back, in different areas, the more symptoms you have, the more at risk you are for chronic problems. Use of seatbelt and shoulder harness. Now I'll tell you, wear your seatbelt. It is imperative. But when you wear your seatbelt, it is designed to protect you from being ejected. It's designed to protect you from running into the steering wheel. It's designed to protect you from all those things that can really break bones, crush organs, and kill you, right? But what it does is it holds you in so it actually can keep your body there where your head can be jarred forward. So a seatbelt and a shoulder harness is definitely recommended, but do realize that it puts you at risk for whiplash and chronic whiplash. The other one is when you see your doctor, if you have difficulties with your range of motion on the initial evaluation, if you can't turn as well, you can't look down for a prolonged period of time, you have limited motion at the very beginning, that is a risk factor. Neck pain, if the doctor feels your spine and feels tenderness along the joints in the spine or the muscles, that is a risk factor. Muscle pain is a risk factor. Initial neurological symptoms, including radiating issues. If you're having pain that's coming into the arm or going into the upper arm or into the leg or buttock, that is a risk factor for more chronic problems. Headaches is a big one as well. If you're having headache, that can be a huge risk factor for chronic whiplash and a past history of neck pain. So if you've dealt with neck issues before or headaches before, you put yourself at a greater risk for having a chronic problem. Also, if they see degeneration on x-rays. Now, if you look at the x-rays and you're seeing your doctor and they see arthritis or degeneration on your films, the degeneration wasn't caused by the auto accident. And what you got to realize is if you have that, the spine is in somewhat of a weaker state, and that can actually put you at a greater risk factor. So although the arthritis might not have been caused by the accident, the fact that you have it puts you at a risk factor for more long-term issues. The other thing that we look at as chiropractors is not only the health of the tissue to see if it is a fracture or dislocation or anything like that, but the position of your spine. Your spine in the neck should have a normal curve from the side. It's called a lordosis. And people can lose that curve. And in fact, what can happen is that when you lose that curve, it's going to cause even more damage to the body. Another one you got to know is increasing age. Now, look, we're all getting older these days, but here's the deal. If you're getting to an accident and you're older, the older you get, you actually put yourself at more risk for chronic problems. And the other one finally to realize is actually the position. If you're in the front seat of the car, you actually put yourself at a greater risk for long-term damage. So there is a lot of complexity that really occurs when you're analyzing a particular patient scenario. Is this person going to do really well? What are their complicating factors? What were their subjective findings? What are they feeling? What do we objectively see through our examination? What did the x-rays show? What did the special testing show? Combined with what are all of the risk factors to create these problems as well. It really takes a person who is a bit of a detective and a person who understands this. So you want to make sure that you're finding the right chiropractor in your area, a chiropractor that is trained and skilled in understanding all the components, can help you put together a plan of care that can offer convenient care, comprehensive care, and a team approach to get you well. So I'm Dr. Eric Janowitz with Synergy Oviedo Chiropractic. Take care.